Welcome to another edition of And Now the News with yours truly, Bill Amos. And my guest this week is Dr. Lyne Filiatrault, who is one of a group of critics of Dr. Bonnie Henry and Adrian Dix over the way they have been handling the pandemic here in British Columbia. But I must say, she is also a very famous doctor in Canada, because back in 2003, Dr. Filiatrault was the first physician in this country to discover a case of SARS. Is that not correct?
That is correct. Yes, at VGH, a patient arrived who had just returned from the now famous Metropole Hotel in Hong Kong. And I had happened to read the communication from the BC CDC that same morning before I went on shift, warning us that there were both atypical pneumonias happening in mainland China, and also that there was an expectation that we would be faced with a severe bird flu coming out of Asia. And so when the patient was wheeled into the emergency department by our triage nurse, and I started getting the story, I immediately thought that it was actually that bird flu because he had just come back with his wife from Hong Kong. But it would later turn out that it was a new disease. It was SARS. There wasn't an element of luck, however, and I'm quite honest about it. The only person who got infected from him, there was nobody on the flight from Hong Kong that got infected. The only person that got infected was his wife, who had been looking after him, though she did not need to be hospitalized.
Quite a pioneering moment, I'd say. Now, in the current situation, you're one of the key members of a group called Protect Our Province, which is comprised of many doctors and healthcare workers and other concerned citizens who've been lobbying for a stronger battle, if you will, against the virus. So in your view, what's the worst thing that's been going wrong in the way BC has been trying to deal with this disease?
Yeah, I would add that the role of Protect Our Province BC is also to educate the public so that they can make informed decision. The biggest error in the pandemic, in my mind, in British Columbia, has been not listening to or following the precautionary principle, and also not evolving the stance of public health as the science evolved. So the biggest failure has been not acknowledging and acting in accordance that this virus is spread through the air that we breathe, that breathing, talking, singing, all of these are aerosol generating procedures. And by not acknowledging that this virus is spread through the air that we share and rebreathe, we have basically been seeing waves after waves of infections. And we have most notably been complicit in infecting patients in hospitals, healthcare workers in hospitals, in long-term care, and also not putting the safety measures in place in any indoor setting, in congregate settings, such as schools. And there's a lot that we could have done before. I think you probably saw that the White House had a Clean the Air Day yesterday, acknowledging that we need to set the air quality standards in indoor spaces and buildings. Now we need to have air quality standards. The good thing about that is not only will it help us with COVID, but it is going to help us with the sick building syndrome. You're from Montreal. There's a lot of sick building syndrome in Montreal because older buildings, mold, what have you. And in addition to that, as we saw last year, forest fires are, going to be a fact of life, it seems, with this climate change. So having increased quality of indoor ventilation and air filtration, as well as monitoring what is good air quality, is going to serve us well, not just for this pandemic, but in years to come.
So if, let's say, that they had not made that mistake, that they had acknowledged that the disease was being spread through the air. What kind of a difference would that have made, do you think?
I think it would have changed a lot of things. We're now 2 years into this pandemic, and we still haven't put all the measures we need to put in long-term care, in schools, and even hospitals. So if you think about schools, we haven't made the investments that we needed to make in having the proper MERV 13 HVAC systems in our HVAC systems in schools. In the schools that don't have mechanical ventilation, not all the classes have portable HEPA filtration. I realize cost is an issue, but there is a simple solution in Corsi Rosenthal boxes that can be basically jerry-rig by individuals and schools themselves at a very low cost, perhaps $100, $200 at most. All you need is a fan and four MERV 13 filters, a lot of duct tape, and a cardboard box. So there's really no reason that we haven't done that. And that we haven't done like Quebec now that finally has put CO2 monitors in many of its classroom. This should have been done a year and a half ago. And here we are in March of 2022, and we haven't done that to keep our kids safe.
I don't really understand unless it's like just a dedication to for want of a better term, outdated thinking.
It is outdated thinking. It is completely. Some of the aerosol scientists have done a good job of going back and looking at the literature and seeing where do we go so wrong. And it looks like it's 100 years ago. One of the scientists that was well known in public health made an error or a generalization that then people ran with for 100 years, it seems. And the reason it's important is that if you understand aerosol, is that there are both short range and long range aerosol. And so if you and I were close to each other, and I was, lo and behold, infected with COVID, I could infect you via short range aerosol. And I'm way more likely doing that than spitting in your face or emitting ballistic droplets or anything like that. And then the other big thing to think about is if we spend time in the same room that is poorly ventilated, like classrooms, many of our classrooms, what happened is over time, the virus is suspended in the aerosol in the room. And therefore, it doesn't matter that you are beyond 2 meters, you will get infected. And in fact, there was a nice case study from California last summer of a teacher who was unvaccinated, who removed her mask and basically had a classroom of 24 students and infected 12 of them. And we had the seating arrangement. And so people in the first 2 rows did get infected, but there were some also in the last row that got infected. And that's despite having 2 meters apart between each of the rows. So there's a lot that we could have done if we listened to the scientist. And for some reason, the people we put in charge, the so-called experts, have denied and refused to look at the science. And in fact, if you look at it, have almost been condescendent with the aerosol scientists, whose job it is to understand climate change, and have spent way more time than anybody in healthcare studying how aerosol form and how they spread.
Well, that's quite amazing, really, when you really analyze it. So what do you think is going to be the future of the disease here? Now but the province has dropped almost all protections. There's no more mask mandate, certainly not in schools. It's kind of advised, if you go out in public, to wear a mask. But I don't know about you, but I've noticed since those regulations were relaxed, the number of masked people in your grocery store or public places is, it's going down quite significantly. So how do we get out of this mess?
Well, let's start with what do I expect? I expect that we're going to be no different than what's already happening in Quebec and is going to be happening in Ontario. So in Quebec, the cases today, I just saw one of the headlines, there are 3,000 cases. So those are the ones they're testing. So we know it's much more. Their hospitalization are also seeing an uptick. And in Ontario, you saw this nice graph circulating of their sewage data, their wastewater treatment plant data showing uptick in the virus. And Peter Uni of the Science Table in Ontario says, based on what he saw last week, they're probably at 25,000 cases of COVID right now and ticking up, right?
Wow.
So we're going to see the same thing. It's happening in Europe. You saw in England and in Scotland, the cases are going up and hospitalization are going up. And it's going to be exactly the same here. In fact, one of the modelers, Jan von Bergman, shared that if you look at the hospitalization by health authority, they're going up for Vancouver Coastal and Fraser Health. So the hospitalization already are going up. You're not seeing that because we're using all of BC together. But if you just isolated those two health authorities, there's an uptick in hospitalization. And it's not surprising because 9 days ago, the sewage treatment plan data for Nordvan and for Fraser Langley was seeing a big uptick in the amount of virus in the water. And that was adjusting for water flow as well. So we're going to be in the same situation. And in fact, we may be worse. Because if you recall, BC was late at immunizing, giving the third dose in long-term care. We waited for Delta to be upon us before we rolled out third dose in long-term care and clinically vulnerable. Unlike Ontario and Alberta that had been immunizing late August, early September. So if you look at, we waited for NACI to recommend the third dose. And so we started immunizing late October, early November. So we're on to the 5th month of people in vulnerable long-term care in terms of their third dose. So that means they are at risk of infection again. And same thing for the clinically extremely vulnerable. We are due for another dose and it should be happening now, but we haven't heard anything. Unlike Quebec has announced, because I still have family there, they've announced the rollout of their 4th dose, and Ontario rolled out their 4th dose during Omicron. So end of December, mid-January. So we're behind.
Excuse me there. It looks like BC is going to have to do another major backtracking move.
Yeah. And like you said, we removed the mask mandate in public transit, in schools, and really we're basically setting ourselves up for failing. So we're decreasing our protection while at the same time our vulnerable groups' immunity is waning. And add to this that the public basically is thinking COVID is over, when in fact it is not over. And the most dangerous time in a pandemic, according to my friend who is an expert in epidemic, Dr. Joanne Liu, who is the past president of Doctors Without Borders International, the most dangerous time in a pandemic is when in your mind you think it's over because you drop your guard.
Oh.
Yeah.
Well, this could be
and Bill, let me
a
add
very
one
bad
more.
time.
Yeah, let me add one more thing as well. Is that well, two more things. the other thing is that there's a myth out there, and I don't know where it's coming from, that people think, hey, I got Omicron, I'm okay against BA2. And that's wrong. We're seeing in the UK that there is reinfection happening. After people got infected with Omicron, they are getting reinfected with BA2. So we don't know the exact number because it seems that people have set a limit for classifying reinfection as 90 days. You need to be 90 days out of your previous positive test. And that may be a fallacy. It may happen faster than we think. So that's number one. So no, you're not immune if you've had Omicron. So don't get rid of your mask just yet. And then the other thing that I wanted to say is we haven't addressed how the virus spread. So nothing has changed. We're removing the precautions, yet we're not addressing how it spreads indoors.
And aside from all of this, which is pretty dire, there's the whole specter of long COVID.
Yes.
Which is a major, major problem for many people who have been through the disease already. They don't seem to be addressing that at all.
They don't seem to care.
Really? You feel that way?
Yeah, no, seriously. You look in, I was just in Montreal. So one of my friends is a GP and she's been suffering from it for 2 years. And she's only back at work part-time. So you've got a crisis in healthcare in terms of staffing. And we have a lot of people that got infected, healthcare workers that have gotten infected, particularly in the last Omicron wave. And we're just at the 90 days when we're starting to meet the definition of long COVID. So how many healthcare workers are we going to lose because of long COVID? Because again, we failed to allow them to wear N95 mask, and we failed to address ventilation in a hospital. One of the things that gets my goat with this leadership is we're failing to look at what other jurisdictions have learned the hard way. I'm from Montreal, so first wave, what did we find out? We found out that there was one long-term care that had 100% of their their residents infected and had almost 100% of their healthcare workers infected. What was wrong? The ventilation failed. And there's a class action lawsuit against that long-term care. People can look it up. It's Vigie Mont-Royal. So they found out the hard way that ventilation was really important. What have we done here in BC for ventilation and long-term care? Nothing, as far as I know. And we didn't allow people also to wear N95 mask for the people working in those settings. So the latest bad infection or outbreak is just go back to Willingdon with Delta. It was, they had a huge percentage of workers infected, and they had a huge percentage of seniors infected, of their residents. And until we understand that we need to address ventilation, clean the air, and allow people to wear the best filtration at their face level, which is N95, we're going to keep having this cycle of infection amongst our most vulnerable in long-term care setting.
What about, a lot of people are just waiting, and a lot of people think normal has returned. Will we ever get back to normal in relation to this pandemic? Will it ever not evaporate, but become like totally manageable, do you think?
I think at some point the pandemic will become manageable, but it is fallacy to use the word endemic right now. When you have exponential growth, it's not endemic. And the only way we're going to get ourselves out of this complex problem is by starting to look at it as a unity. We're all in this together, and we need to be all in this together to allow the virus to run rampant in Hong Kong, in China, in the UK, in Scotland, and wherever else, and here as well, is basically we are contributing to the problem. We cannot end this pandemic without managing transmission or limiting transmission. And right now, there's not a political will to do that. There's a false dichotomy that has taken a hold that it's either health or the economy. The reality is there is no economy without health. I was just presenting at TransLink recently, and their ridership is back up to 64% pre-pandemic. And I basically said, if you wanted to go back to pre-pandemic level, you have to monitor the air quality, you have to filter the air, and ensure that you have sufficient ventilation, as well as reinstate mask mandate. And until you do those things, the riders will not feel safe, and they will not return. So, if you don't address the root cause, so the conditions that gave us Omicron, which are still existing right now, we're going to be having this wave upon wave upon wave. So it is really imperative that we understand that at the local level, we need to maintain the safety of everybody and limit transmission. And then we need to do that at the world level by sharing vaccination. And unfortunately, we also need to be spending money on vaccine, because vaccinating every 6 months with a vaccine that protects us against severe illness, but its protection against transmission wanes over 3 or 5 months. We can't just repeatedly vaccinate. So we need to have a vaccine plus approach. Plus, we need a vaccine that allows to stop transmission. And we haven't found that yet. There's hope with a pan-corona vaccination, or with some of the work out of Yale and McMaster on a intranasal vaccine that can stop the infection as we're breathing it in to prevent the infection from establishing. Right now, we don't have that.
It doesn't sound very promising, I must say. And many of us are baffled as to why the leaders of this province continue to make decisions like this, as if it is an endemic, as if there's nothing much to worry about, and they're not seeming to be vigilant. So one hopes that once the numbers start to go up, they'll kind of like come to their senses, I guess.
But again, it's exponential growth.
Mm-hmm.
So we've removed all the methods of tracking this virus, save for wastewater, and wastewater is about 10 days behind.
Mm-hmm.
Right? So we need to be 2 steps ahead, and that's really where we need to be. Why are we not tracking people testing with rapid tests? And I mean both the positive and the negative, so that we can have a surveillance process on that can say, hey, look, the number of rapid tests turning positive is going up. And at Christmas, if you look at it, instead of rolling out 3rd dose, we actually closed clinic. We told the people that were measuring the sewage data to take a holiday. You can't have that. You need to have everything on all the time so that we can surveil and say, hey, it's back. We have to let the public to be aware. If you don't tell them, when they went to Christmas at Whistler, the test positivity rate around Christmas was 25% plus. And yet you were telling them, go have a great holiday, and you can go to a restaurant and take off your mask for 3 or 4 hours. Made no sense, right? So we need a layered approach. We need to be 2 steps ahead, and we need humility to say, we were wrong. We need to pivot and do better. And And the way we've done it is we've put people in charge that have their purpose is possibly not aligned with our purpose, which is to keep the whole community safe. Remember, politics, we had an election during the pandemic. That tells you where the priority lies.
Yeah. I'm a little bit, I'm more than a little bit worried. I think many of us are very, very concerned about what's going to happen. But hopefully, as I said earlier, once the numbers start to sink in, a real urgency, will take over. I hope.
Well, the urgency is now. If you pull out the data, and the modeling group is going to have another report next week, but the data that was pulled by Jens von Bergman shows that admissions are going up in Fraser and in VCH, and it aligns with the data from sewage from 10 days ago. So, exponential growth is, you can't be reactive. You have to be proactive is what I'm trying to say. And if we haven't learned that now, I'm not sure we're ever going to learn it. The other thing as well is, if you listen to the father of social determinants of health, Sir Michael Marmot, we can't go back to normal. We need to build a fairer and a better normal. And the countries that have done the best are the countries that have cared for everybody. And if you look at the United States, they have such a poor safety net. They've done awful. And the numbers of death don't really represent the true numbers of deaths. So we need to really look after our marginalized people, our people that have to make a choice between going to work or going to work or staying safe at home. And if they don't go to work, they can't put food on the table. Like, it's not when we need to have everybody safe in order for us to be safe. Because if you allow this virus to take hold in part of your community, it'll come back in the rest of the province. We saw that with Delta in the north, right? Mm-hmm. They weren't doing well. What happened then? Cases were transferred here, and then people's surgeries were delayed. And we're basically affecting everybody by this poor handling of the pandemic. And the quality of healthcare we're able to provide, because we're burning out our healthcare workers, and also because we're providing access to a longer and longer waiting list. At some point, we're not going to be able to provide the standard of care that we as Canadians think we deserve and we expect.
Well, Dr. Filiatrault, thank you very much for coming on the podcast, and thank you for your information. It's pretty serious, and we can only hope that it can help to influence a change of mind in the people who are supposed to be setting the healthcare policy. So I know you're going to continue to be on top of this, and we'll continue to follow you in that pursuit of proper policy. And again, thank you very much for coming on.
Thanks for having me on, Bill. Take care.
All right. You too.